Hi, this is John. This is discussion board 7, the case study assignment. Working as a neurologist in Baylor downtown Fort Worth, I've seen many different cases come through the doors. Everything from schizophrenia, stroke, and then the most commonly seen problem I've been seeing in my practice is Alzheimer's disease. As being part of working in such a big hospital, I expect to see a wide variety of cases. Alzheimer's has just become a very rampant problem within the last year. We've seen a jump from 75 cases to 150 cases. With the common symptoms seen with Alzheimer's disease, neurofibrillary tangles, binding of the proteins in the brain. We're also seeing a lot of neuropathy. There's different medicines used commonly for Alzheimer's, like galantamine and donepezil, are commonly prescribed for treatment. We've also been seeing that there's a correlation with the physical health, whether it be nutritional choices and dietary nutrition choices, and along with sedentary lifestyles being common themes with some of these patients. Due to the nature of the polyneuropathy, movement and exercise would be very beneficial in preventing some of the decaying of these nerve ends. And usually, sometimes with more severe cases, with patients will prescribe gabapentin for help relief with some of that nerve pain. Just last this week, I had a guy come in, late 70s. He's suffering pretty bad from Alzheimer's. He's having a lot of the commonly seen symptoms, but he had also severe cases of neuropathy. He came in, he was in very poor health. He had not been seen by a doctor until early this year, and he was referred to my clinic. He was, low income, not making a whole lot of money, living off Social Security and disability, BMI of 32.8. He was also basically diagnosed with metabolic syndrome. He hadn't came in enough times to meet the criteria of 2 times per, but he tested very high triglycerides, high waist to hip ratio, and multiple risk factors for the condition. He complained also of pain from his feet, which we divulged was probably due to the neuropathy at the limbs. It's commonly seen in diabetics, cardiac disease patients, and it's not, we wouldn't say that's a direct result of the Alzheimer's disease, but it's definitely seen a correlation with it. We prescribed him some medicine for Alzheimer's to help alleviate some of those symptoms, gabapentin for his pain relief, and then we also got him referred to OT to help work on just his daily life and like improving his physical activity levels, nutritional choices, and just kind of like getting him into a better condition overall to help alleviate some of those problems that he's having. I see with the majority of the cases in my office, there's a high correlation between lower socioeconomic groups, poor physical health, and just general lack of education around how to prevent these health issues. We educating at an earlier age, just kind of the effects and consequences of what the actions that they're taking now are going to have later down the road is going to do a lot more in just trying to fix and solve prescribed drugs for the problem that we have at hand. Conditions like neuropathy, Alzheimer's disease, stroke, other things that with lifestyle choices would be much minimized with the risk factors moving forward. Earlier on, I would also when early symptoms are seen, usually during physical cerebral angiographies, just kind of looking for the bundling that we see, which is very easily detectable using most of the graphs of the brain, with something that we could detect and kind of work on, and even more try to invasively treat at an earlier age instead of waiting until these late onset cases. There's really not much we can do. But the major issue at hand is just a lack of education, some responsibility for the actions, and part of that's like if you don't know that you're doing something wrong, then you can't be held accountable for it. Breaking the ignorance on the mold is going to help provide better healthcare for patients down the road.